So if you have a medical condition and you're comparing Medicare Supplement Plan G versus Medicare Supplement Plan N, then this video is for you. I'm going to break down how your health impacts which plan is better and the big mistake people make when they have health conditions. Before we jump in, if you want personalized help, call the number below or use the link in the description to book an appointment with us. So just a quick refresher on Plan G and N. They are the two most popular Medicare supplement plans. Both cover hospital stays, skilled nursing, hospice, and most outpatient care after Medicare pays its part. So what's the main difference? Plan G covers everything except for an annual deductible of $257 in 2025. Now that's the Part B deductible that you have to pay, and Plan N has the same deductible, but it's going to have co-payments at doctor's visits, office visits, emergency room visits, and also Plan N does not cover Part B excess charges. So if you have a medical condition, you are much more likely to use your Medicare benefits. That means you'll have more doctor visits, specialist appointments, lab work, imaging like MRIs, and possibly hospitalizations. So all of that usage makes Plan G a much safer, more affordable long-term choice. And let's take a look at why. So the first part is the co-payments. On Plan G, you don't have any co-payments at all. Remember, you just have to meet that annual Part B deductible, and then Plan G will cover you 100% for the rest of the year after Medicare pays their share. Plan G will come in and pay the rest. So no office visit co-pays on Plan G, whereas on the Plan N, you'll have $20 at each office visit, or up to $20 at each office visit. And also the Plan G, you'll have no surprise charges like excess charges like you have on the Plan N. So that's one less thing to worry about on Plan G if you're using the plan a lot. We recently had a client with rheumatoid arthritis, and after starting Medicare, they saw a rheumatologist every 2 months. They had blood work quarterly. They needed outpatient procedures within the first year. If they had picked a Plan N, they would have paid $20 for every specialist visit, $50 for outpatient procedures, and possibly excess charges if the doctors they went to did not accept Medicare assignment. Instead of going with the Plan N, we recommended a Plan G, and they were glad that we did because all they had to pay was the annual Part B deductible, which in 2025 is just $257 for the year. No co-payments, no excess charges, no surprise bills. Peace of mind that everything's going to be covered on their Plan G. So here's a checklist to help you decide between Plan G and Plan N if you're thinking you're going to be using the plan a lot. So do you have a chronic condition like arthritis, diabetes, heart disease? If yes, you probably want to lean towards a Plan G because you may have ongoing office visits and specialist visits. So in the Plan G, you will not have any co-pays. If you get into a situation where you need to see a specialist once or twice a week, that $20 can add up. So we'd recommend you go with the Plan G so you don't have to worry about those co-pays. Another thing to consider is just billing stress. If you want to eliminate billing stress altogether, Plan G gives you more predictability because all you have to pay is that annual deductible of $257 in 2025, which is the Part B deductible. After that, you're covered. No co-payments, no excess charges. And lastly, we talk to folks all the time who are just concerned about the excess charges on Plan N. Even though they happen very rarely, it's still a concern. So if you want to avoid that altogether, we recommend just going with the Plan G. That way you don't have to worry about it. So overall, Plan N is still a great plan. It gives you a lower premium. You do have some out-of-pockets. It's a great fit for a lot of folks out there. But this video is really for folks who are kind of weighing between a G and an N and may have health conditions that require them to go to the doctor more. And a Plan G would be a better fit, in our opinion, to protect against the co-payments, excess charges, and just overall use of the plan. You'll have less headaches on the Plan G, no extra billing. So if you have chronic conditions, Plan G is the way to go. If you have questions or need help with your Medicare, give us a call at the number below. Don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.